See, one of the major challenge that Ayurveda faces today, I think, is the perception in people's mind. A lot of people think that Ayurveda takes a lot of time to heal. It's very costly. You might have to follow a lot of regimen, special kind of food and all. What is your take on that?
Well, in fact, doctor, one thing about is that the persons who come to take Ayurvedic treatment, they kind of try all other resorts. And finally, when they come to us, it's like
This is like an
Ayurveda
end
this is the end option, or this is the last resort
Yeah.
they can do for the particular ailment. In fact, that much time would have made the disease so much chronic. Well, it is to a certain extent true that by the time our medicines act on the body, it is time taking. But if it would have been diagnosed and if it would have been, the condition would have been brought to Ayurveda at an earlier stage, it will never be a time taking process.
True. As far as I understand, and from our practice, what we generally see is that if you diagnose the patient correct, and if you choose the right medication along with proper food, every disease will give a result, like a positive result, within a week or so, right?
That is true. That all depends upon the cooperation from the patient, because many people, like they say, is they are very much skeptical because since they have tried all other measures, they are usually very skeptical about how the medicines will usually work. So some people will not be taking the medicines as per what the doctors have instructed, and that in fact leads to again a time taking process for the healing of the condition.
And I think the chronicity of the disease will also make it difficult to treat, so that the Ayurveda doctors has to resort to more, IPP treatments, Panchakarma procedures, which are costly, true. But if we get the patient in the initial stage, I think we can manage with simple medications, simple home remedies, and that kind of stuff.
That I agree with.
The other thing I think, which is a lot more common among people, they think that Ayurveda is kind of a vegetarian science. Whereas we know that in a lot of instances, Ayurveda actually promotes using animal source, like it is advised to take chicken soups, advised to take meat soups in different diseases, like in Rajekshma, it can be correlated to TB if you want, right?
One thing, we say that Ayurveda is just not a medical science. It is a system where it teaches a person how to live. And in fact, if you look deep into the textbooks, as you know, that it has explained varieties of food, wherein the different type of mamsas or the meat is explained. If it would have been a vegetarian science, probably the acharyas or the mentors who wrote the entire textbook would never have written about, or would even have not even bothered to mention about anything about the mamsas or the meat. In fact, persons who have undergone depletion, it says that the different types of the nyavara kiri, Mamsa Nyavara is one of the treatments that is advised, wherein the meat of goat is actually added. And when we say about the best things in the Ayurveda, it says that the Kukkuda Mamsa, that is the meat of the chicken, is the best to relieve a person's debility.
Yeah, it's also mentioned in Vatarakta Adhikarana that it's a certain type of arthritis, if you want to relate to. The meat of chicken and the soup, it will be a better food compared to other vegetable sources.
So I wouldn't say that it is not a vegetarian science, but again I would like to clarify that why it is preferred that the patient be a vegetarian during the time of the treatment is because the metabolism that the time taken by the body to metabolize whatever non-vegetarian food is being taken into the body is more when compared to a normal or a natural or a vegetarian food. So, and also sometimes this will be incompatible with some of the medications that has been prescribed. That is the reason why generally people are usually instructed to be on a vegetarian diet.
You can also notice that if you eat a non-vegetarian diet, you'll feel much more tired than light. If you eat on a vegetarian diet, it will be easily digested. That will also ease the process of healing. Then I think the other misconception is like of exercise, I guess. A lot of people think that, and this is not related with Ayurveda, however, but think that exercise is a good thing. So this misconception is like I'd get a lot of patients who says that, okay doctor, I think running is a good exercise, and I would run 5 kilometers per day. They would think, okay, if running 5 kilometers is good, then running 10 kilometers would be much better, right? So they go on doing this and end up in arthritis and some kind of stuff. So you might know that Ayurveda doesn't work that way. So according to Ayurveda, exercise is not to exhaust, but to give a physical activity, right?
That is true. No, that is clearly being described in the daily regimes of Ayurveda, wherein it clearly explains how a person should do an exercise. Exercise is actually to ease your body. Like Dr. Karthik said, it's not something to exhaust your body. So one should do an exercise to the half of his capacity. For example, if he is capable enough of doing, say 10 or 25 push-ups, it should not be that he should be doing his entire session. In fact, it should be done only till the half. For example, if it is 10 push-ups, probably 5 push-ups should be the apt thing that he should be doing, so that he does not exhaust himself, but rather eases his body.
So it syncs with the total message that Ayurveda gives out, like balance is the key to healthy living.
Healthy living.